The fall season is fast approaching, and tonight, doctors are worried about the upcoming flu season, saying it could be a nasty one. Add that to the current COVID surge that we're experiencing, and it means added stress on our hospitals. So for tonight's big story, doctors share their concerns about the potential of a twindemic, and they share 2 simple ways to protect yourself and your family. We'll also dig into questions about how soon you can get your flu shot after getting the COVID vaccine.
Last year was one of the mildest flu seasons on record. Mask mandates and restrictions keeping the numbers down.
But the situation is much different this year, and it leads us to think that we will have at least a normal flu season, if not a bad flu season. And if we do, it's going to be problematic for the healthcare system.
So far this summer, physicians have already reported seeing an unusual amount of RSV cases and other viruses among children, a possible indicator for what's to come this fall and winter.
And because people are taking fewer precautions than they seem to be this time last year, that really leads us to believe that we're at risk of a twindemic this year.
But for right now, flu cases remain low. Currently, the state is averaging about 750 flu tests a day. Of those, about 14 come back positive. That's about a 2% positivity rate. Now compare that to COVID, which is at 11%. And as we get into the flu season, the other challenge will be knowing the difference between the two, since COVID and flu symptoms are so similar.
We have rapid tests for both. We have, tests that take a couple days to process for both. And so we'll start to see both kinds of tests being more common during the flu season this year in order to rule out one or the other disease.
Experts say it is possible to contract both viruses at the same time, but it is highly unlikely. To protect yourself, doctors say it's simple. Wear a mask and get both vaccines.